welcome. This is going to be our first live video, the first ever live video for Focus Physio. Something we're going to try and do a little bit more for those of you out there who are following us and who are just thinking about whether you guys want to have a consultation, have a physiotherapy session, and just a little bit about what we do, and hopefully just gives you an idea. Hopefully we can break the ice this way first before you put your trust in us. So for today we've got a very special guest. We've got Gemma Monachino, all the way from Evolve Integrated Health Specialist in Auckland. She's down here doing a master's in sports physiotherapy at the University of Otago.
Yeah.
Welcome.
Hi, nice to be here.
Cool. Sorry you had to come down to cold in the weather like this.
And then it's turning it up. It was a little bit mild when I got here on Saturday, so it's definitely turning up the weather I expected to be down here.
So I guess what we want to talk about, Gemma here, she's a bit of a stirrer, and not too long ago, I will post this up on our physio page. She wrote an article for the Sunday Star Times about medication and misdiagnosis of back pain and various types of back pain that we see in the clinic. How sometimes if you go to see different clinicians for an injury, you can get 10 different diagnoses. Mm-hmm. And it's something we want to try and hunker down and try and make sure we give you an accurate diagnosis each time. So I'm just going to let Gemma talk a little bit about her article.
Yeah, so Josh, what prompted me to actually reach out and speak about this issue is the fact that we see, it's really common in the clinic that in Auckland we see a lot of misdiagnosis and therefore poor management. If we're not diagnosing well, or if something's not diagnosed well, as you know, then the management that follows isn't necessarily appropriate. And the concern is that we are having a huge increase in the opioid prescription in our country, and when we look overseas and we consider what's happening in America and in Canada, we need to be concerned because the pharmaceutical companies here are able to advertise for medication, and so we see if your hammer is whatever your tool is, we're going to pull that out, right? And so the strength that we have as clinicians, as physiotherapists, is our diagnosis, and as a McKinsey credentialed therapist in mechanical diagnosis and therapy for extremities and spinal injuries, I feel really passionate about the importance of diagnosing and getting these injuries on the right track as early as possible. Now, there is, I did a bit of looking around, and there is quite a consensus that unfortunately musculoskeletal knowledge within our undergrad medical degrees isn't the strength that it is with our physiotherapy and perhaps our chiropractors and things, other professions that way. So the point was to raise some awareness. It certainly isn't to point fingers at other professionals whatsoever, but it's to say, look, our primary healthcare providers are our first port of call, and a lot of people don't understand that you can come and see a physiotherapist before going to see a GP, and in the event of an injury that is musculoskeletal in nature, we do specialise in this field. So if we can address a few issues along the way, and one of them is offload our primary healthcare providers and field people to those that are best suited for some injuries and some natures, then perhaps we're going to see better outcomes for our communities as well. And there's nothing worse than seeing somebody in severe pain from a back injury, but as we know, if we can diagnose it well, we can see them turn around really quickly. Yes, and I'm not talking about your traumatic injuries that are from a result of a motorcycle accident or a trauma that is unexpected, but I'm talking about those acute derangements that can sometimes be severe pain for people, that we can settle, like I said, very, very quickly, and get people back to full function. And as we both share, that's passion, and I do believe that that's possible. So all for helping out the bigger picture.
And I think people these days take offense really easily.
Oh yeah.
And I guess for our clinic, we've established some good relationships with a few GPs in our community, and we've got a really good understanding So that's been really helpful
And that's
in
the
our
first
side.
part. Yeah, and that's the first part. I think, you know, as I said, we need to think bigger picture and looking at how can we serve our communities better, how can we, if we know something's happening and we sit there and shrug our shoulders and say, oh well, you know, it's just the way that it is, we don't want to rock a boat, then are we actually, how ethical is that as well? So I have gone out on a limb, and when you stick your head out you might get it chopped off. So I've actually had really good feedback, which I'm really excited about, and a lot of support, particularly from the Mackenzie Institute community, which are awesome, and fellow colleagues up in Auckland and in Australia as well, who are reporting they're seeing similar issues happening.
Oh, thank you very much, Gemma.
Anyway, so if you're in Dunedin, come and see these fellas here at Focus Physio, because they are super awesome, really knowledgeable, and it will get you moving as quick as possible.
I guess one of the reasons we've sort of been attracted with Gemma in the clinic is because we've met each other at a good few courses already, and I guess just recognizing each other's passion and thirst for knowledge, we've just happened to meet each other in each other's different courses, and I guess we'll see you at the next one.
Absolutely,
all right.
Definitely.
Thank you very much.
Thanks for having me.
Till next time.
Ciao.
Thanks for listening.